Best Practices on Securing Unmanaged and IoT Devices, sponsored by Order. My name is Jessica Gallus-Sands. If during the webcast you have any questions for our presenters, please enter them into the questions window located on the GoToWebinar interface at any time. Please note that this webcast is being recorded, and a copy of the slides and recording of this webcast will be available for viewing later today and can be found on the SANS registration page. And with that, I'd like to hand the webcast over to Russell.
Hey folks, thank you very much for joining us today. To reiterate, and we're looking forward to giving you a presentation right now and a discussion around best practices to secure medical, unmanaged, and IoT devices. We're going to provide you a view from the trenches based on learnings from Cleveland Clinic and Level 9, who I'm joined by. First, to reiterate some of those housekeeping items, just want to make sure that there is a Q&A at the end. Feel free to type in Q&A questions as you go. We can respond online while we're going, and then we'll summarize some of the key ones as we go at the end too. So don't hold back till the very end. You can interact with any of us on the presenter side, myself, Jason, and Kevin, via LinkedIn, and you can see the links there. So please feel free to do that too. We love increasing kind of our interconnected base there. And we are being recorded. I want to reiterate that so everybody knows it. So let me do an introduction of some of the folks we've got on the line with you. First, we're fortunate to have Kevin Tambasso join us to anchor our presentation. Jason, do you mind flipping one forward? Kevin is the manager and leader of cybersecurity for medical and operational technology devices at Cleveland Clinic. Previously, he worked in cybersecurity and software engineering at Rockwell Automation. And he was also at Keyfactor, a PKI firm. We're also pleased to be joined by Jason Sintak, who leads the cybersecurity testing and threat management practice at Level 9. That happens to be an elite cybersecurity service company with focus on healthcare security. Level 9 helps organizations with vulnerability management, secure development, and regulatory approvals. My name is Russell Rice, VP of Product Strategy at Order, and I've been in the product side of cybersecurity for over 25 years. Order offers a product that's used by enterprise companies, including healthcare organizations, to protect the whole environment of IoT, OT, and unmanaged assets from cybersecurity threats. This includes medical, facilities, physical security, and media devices. Basically all those devices that are connected to the network, but generally not managed by IT and that don't support the use of security agents. We're honored to work with many organizations who help answer four major questions that are really important. First, what devices do I have? Second, what are they doing? Third, which ones are vulnerable and should I pay attention to? And fourth, being able to implement protections around them. Anyway, enough about Order. Let's get to the meat of the conversation. In this session, we're going to focus on three key areas for you. First, Jason's going to provide an overview of some of the risks and trends and kind of why you should care and what types of targeting and threat landscape that exist for this area. Second, we're going to go deep into a case study where Kevin's going to talk deeply about what's going on at Cleveland Clinic, how they've organized, what their careabouts have been, and some of their learnings and experiences. And then we'll summarize with some key takeaways and spend some time on Q&A. So without further ado, I'm going to hand the baton over to Jason, who's going to dive into the threat landscape.
Great. Thank you, Russell. As mentioned, I am Jason Sintak, and I lead our product security and threat management practice at Level 9. We are a firm that focuses specifically on cybersecurity and healthcare, on the provider, manufacturer, and payer side. I think we provide somewhat of a unique perspective on both sides of the aisle, specifically when we're talking about this issue with IoT and operational technology as a whole. Having worked with both manufacturers as well as providers, and we firmly believe that if you have an understanding of the issues on both sides of the aisle, you can be better equipped to work together and improve the landscape. This really isn't an issue that is solved by one party or the other, but if we come together as an industry, we can definitely achieve a much better cybersecurity profile beyond what a regulator may be able to do. So with that said, operational technology is an umbrella term that we use to describe a number of IoT and embedded assets. Things like IoT, industrial control systems, and medical devices fall under the umbrella of operational technology. And so naturally, what exactly is operational technology? And that effectively is the most important asset that you never knew existed. And if you think about how tough it is from an enterprise perspective today to deal with some of the cybersecurity threats on an ongoing basis. And you imagine a situation where you're dealing with effectively an existing issue, and now a whole new class of assets suddenly appears. These assets could be, they're old, maybe 10 to 20 years old. Cybersecurity has never seen them before, and there's more and more of them coming into the organization. Essentially, these types of assets are black boxes for the most part when it comes to not having access to them or really understanding what they're doing in your organization. So fundamentally, OT is the hardware and software that keeps things running. From factories, power plants, hospitals, even service organizations have these in some capacity, even to the point of just VoIP phones. These are the devices that nobody really talks about because they do the heavy lifting every day and they just kind of work in the background. They weren't always connected in the past, but many of them are now, either old or new. And one of the topics that comes up often is around, it sounds kind of like IT, right? Operational technology, information technology, like what is the actual difference here? And fundamentally, when you talk about traditional IT networks or traditional IT assets, they're kind of the tip of the iceberg. So if you use this image here to kind of look at the landscape of how things have fundamentally changed over time based on the trends that we've seen. And specifically, you kind of see that where enterprise assets are mostly the managed assets of your organization, and BYOD, BYOL, trends have kind of shined a light on some of the difficulties in managing devices that you don't necessarily own or have full transparency into. SaaS and cloud computing have further changed that landscape as more services are moved and to employ vendors and or move entire systems outside of your data center into AWS or Azure. It has fundamentally changed like what's actually left in the organization, and you come to realize that what's left to manage is really this big operational technology set of assets that kind of underpins the organization and keeps things running that virtually will never leave your walls. One way to look at this is from the impact perspective. So we take an example of, say, ransomware, and ransomware in the IT realm, may result in the inability to do your job because you can't access a network share. And so I can't open up my spreadsheet or I can't connect to some application. That's a problem, but in an OT space, ransomware can present a problem where the devices don't even work. Like we can't provide care anymore from a healthcare perspective, and you have to fall back on manual processes and devices that you rely on for scale are no longer available. So it's really a situation that can be very impactful, specifically in a crisis scenario. So like I mentioned, the categories of operational technology, they can be far-reaching and essentially everywhere in the organization. We like to talk about the Internet of Things, or IoT, as things like smart TVs and smart lighting, wearables. These are kind of the consumer assets that can end up in the enterprise one way or the other. Industrial control systems are kind of your traditional category of these types of devices that have been around for many, many years. And to be honest, that industry has kind of addressed this problem and tried to address it for many, many years. So there's a lot of good examples to be learned from that particular category. And then medical devices, specifically in the provider realm, introduce a whole nother level of potential complexity of what we call the operational technology onion. As you peel things back, you kind of expose more and more of what these devices actually are. And the real problem is the difficulty in managing these devices when their characteristics are so different. Even the skill sets required to potentially evaluate these devices and determine their needs is drastically different. So I want to take a little bit of time before we dive too deep into some of the problems here to talk about what is happening today with the COVID-19 response and potentially what that means for this space going forward. Because believe it or not, medical devices are front and center in the news. They have been for the last few months, and clearly it's going to have a fundamental change on this particular category. And we kind of see two things happening. One, there's a short-term potential impact here around the expansion of existing devices. So an influx of new devices, field upgrades being performed, networks being extended just to scale the amount of care with the existing devices that an organization may have. On top of that, we have new devices with potentially unknown capabilities and devices that have been repurposed entering this space on the provider side. And a lot of this is driven by some changes on the FDA side to essentially relax some of the enforcement policies that have been in place that normally would restrict the manufacturer from repurposing a device in a particular way. And if you're familiar, typically manufacturers submit 510Ks to the FDA to essentially get an approval that details the circumstances around which a device can be used. And by relaxing that, the FDA has basically allowed some devices to be repurposed to assist with the shortage of respiratory ventilators and things like anesthesia machines or sleep apnea machines and ventilators that have been mostly for at-home use can now be deployed, in the hospital network or in the hospital to assist with the cause. And on the modified device sides, you can modify physically a device to some extent now, whether it's the boards or the potential connectivity without seeking prior FDA approval for that. So there's a lot of short-term kind of expansion of what is operational technology just to deal with the situation at hand. In defense production, if you're familiar, I'm sure everybody has heard that to some extent, that is essentially another little pillar of this short-term impact. And most are familiar with what that is, but essentially we are producing what is the model Newton AE ventilator at scale in the tens of thousands. And these are going to ultimately end up somewhere within the organization or in the strategic stockpile. These are actually mechanical devices, so they don't present a network risk, but it gives you an idea of just the sheer volume of device need that is out there. There's actually a picture on here of a jetliner landing, and actually I believe that was one of the shipments from Russia that contained a number of medical devices as well as other things. And it just goes to show you that there's a very large short-term impact and increase in influx in new devices being deployed. And more or less, when you look at history, when stuff gets plugged in, it usually doesn't get unplugged, especially in this circumstance very often, and more likely these things are here to stay for a very long period of time. Long term, we like to think of this as essentially the great acceleration. We're kind of living in the future right now because all the trends from the last 5 to 10 years are going to be compressed into almost 6 months. There's a potential that, who gives care and how could change forever. There's going to be more smart devices, potentially more surgical, more monitoring, more wearable devices, contact tracing, all that good stuff, and potentially safer and more scalable care with OT. So for an organization to be able to expand and exist and be able to provide extra care during crisis, you're going to need more OT devices. So we're starting to see that across the board. We're also starting to see a decoupling of software from hardware as more medical devices are becoming effectively software. Software can be a medical device, and once something becomes software, typically that's where you have the great accelerator, no matter what the industry is. So we expect that this problem, to be much larger long term, the OT problem overall, especially when it comes to volume. So it's a growing issue. Right now there's at least 20,000 manufacturers, 17 devices per hospital bed. At least a quarter of those are networked. There's a big demand for this from the providers. They want increased monitoring, bedside monitoring, turning, walking, pretty much anything the patient does can be monitored. Centralized monitoring is very big, electronic prescriptions, health records, at-home care, building automation. There's just a number of drivers and demand in the market for that. And these trends have a lot to do with that. So we have things like networking stacks that are becoming very cheap. Hardware has been commoditized, and so now it's very easy to basically make anything smart. It's almost impossible to buy a smart TV that doesn't have Android running in it. Unfortunately, as things get less expensive, they get more risky. There's less and less security put into, obviously, a consumer-grade IoT device than something commercial that you would see. Data is valuable. So for example, on the manufacturer and provider side, data, I think, is going to be one of the biggest things in the next 10 years. As manufacturers, traditionally sell devices and disposables, there's a lot of new business to be had in analyzing the data from those devices. So connecting them to be able to improve treatment and such is the future of some of that. And on the provider side, being able to do holistic analysis of patient records, and make those kinds of determinations at scale means more and more data, means more connectivity. And I always thought it was interesting, if anyone's ever wondered, like, why do I have to call the doctor? Why don't they call me when something's wrong? Which is probably the future of it. It's just more and more connectivity. And automation, it's pretty straightforward, but in the healthcare space, it allows scale, and it actually provides better and safer care because there's less human error involved. And especially when we're talking about COVID and the ability to do things remotely. So with OT, we get a new term called forever day exploits and new threat actor behaviors around staying off the land. Now, if you're familiar with 0 days, those are essentially vulnerabilities that come out the day of. So it's the first day of the vulnerability, the 0 day, and that is normally a vulnerability that doesn't have a patch. You see that in Windows or whatever type of common software-based solutions in the PC space or wherever. In the OT space, when something like that happens, it is well known, but typically the patching that you would expect to see doesn't occur. In some instances, the devices are so old that the manufacturer doesn't actually exist anymore, so you're clearly not going to get a patch. Or even if a patch is out there, the customers of those devices don't even know that they have them. And as the device gets smarter and smarter, we have more and more potential avenues for 0 days to turn into forever days. There's an example where in VxWorks earlier this year, there was a bug that in the networking stack that exposed something like 200 million critical devices because they all share, it's a very common real-time operating system. If I had to guess, probably of the 200 million devices that were affected, maybe 190 million are actually, or 10 million are actually patched. And the 190 million are still vulnerable because the folks that have those devices just don't know they have them. They don't even know what VxWorks is or where that device is in their network. Staying off the land is an interesting phenomenon. If you are familiar with the term living off the land, we do a lot of pen testing in the traditional IT space, as well as a lot of embedded device and medical device assessments. And living off the land was the way to avoid some of the traditional enterprise IT detections that were out there, where you would get on a host and you would make use of the tools that were on that host instead of introducing new malware or anything of that sort to evade detection. Staying off the land is kind of a concept that I think works really well with operational technology, because now when you get into the environment, most organizations have locked down on the endpoints that they manage, and they have endpoint detection and SOC monitoring focused heavily in very sophisticated stuff. So trying to compromise those endpoints and persist on them is risky because you could get detected. Staying off the land is more so you can focus on some of these operational technology devices that exist in the organization, compromise them through these forever day exploits, and persist. And these are essentially dumb devices the organization has no insight into, and you can stay undetected for extensive periods of time. So I want to kind of walk through just briefly kind of the mindset of a threat actor. Because I know a lot of times when we talk about vulnerabilities or embedded devices, it gets very complicated and it sounds very theoretical. But to be honest, I mean, this process is pretty specific and it's pretty repetitive no matter what the device is that you're looking at. It's not your same skill set that you would have from a pen tester that works in, has been pen testing networks or applications. But it is a slightly different mindset, but the process is pretty straightforward. I mean, if you're targeting a hardware device, you obtain access to that device, you take it apart, and you go after the software that it has to find the vulnerabilities that are going to be valuable to you. I mean, there's no Metasploit here, but it is a process that if you just get access to the device, I mean, you would be surprised what you've seen, because some of these devices are just so old that no one else has ever looked at them yet. One of the obvious avenues where this happens is through researchers gaining access to some of these devices through the aftermarket. So things like eBay or just contacting resellers. I mean, you can get access to devices that are cheap, like $500 to $1,000, or the more expensive, like larger devices, for a fraction of what they would normally cost. We actually have a situation locally. We're based out of Chicago, and we had a relationship with a retailer or a reseller where they have a warehouse, right? And if we pay them some money just to give us 12 hours in their warehouse, we can get access to some of these machines that maybe a hospital only has 1 or 2 of. And nobody has certainly ever looked at those machines because no one would risk letting someone look at it from a cybersecurity perspective, and because of how much it costs, and the fact that it is such a critical device. So a lot of this has to do with just accessibility to the devices themselves. The vulnerabilities exist, it's just a matter of getting the time and resources to look for them. I just want to talk a little bit about the hardware itself. I mean, there's a misconception around there on how difficult it can be to gain access to the hardware and to the software and to find these bugs, which has some truth to it. I mean, this is not easier than your conventional pen testing or anything of that sort. But at the end of the day, I mean, hardware is built to be manufactured, and there's a manufacturing process in place where at the end of manufacturing, you have to test that hardware. And a lot of those means of testing it are other ways of gaining access to the software that's on there. And, you know, just from our experience, like we do that all the time. We take apart devices and we leverage those debug and test capabilities to extract firmware and find vulnerabilities. Sometimes you have to remove chips, but we know once you do that, it is basically an exercise in software reverse engineering. There's no electrical engineering degree required. I mean, this looks complex and it can be very tedious at times, but it is something that a wide array of threat actors are capable of doing. Now, this is a kind of an interesting slide. Often when we do this kind of work and we find the vulnerabilities, specifically in the medical device space, you know, we try to outline and demonstrate the patient safety impact of possessing the vulnerability. And typically that's something of, you know, being able to affect the treatment while it's ongoing, or being able to modify the reporting information that is being sent to or from the device and that is being relied upon by a clinician. But sometimes it's just easier to convey the impact by showing a good old Doom game running on it. This is actually from a real engagement a couple of weeks ago. So some war stories. This is real. I mean, we've seen this on both sides of it. We've seen it where these types of attacks have taken place. You don't hear about it in the news a lot because it happens at very small scales. If there's a VIP somewhere in some provider, you know, attacks do start. There is interest, threat actor interest in gaining access to those environments where the VIP may be for various reasons, and medical devices and IoT devices in general play a role in that. For example, I mean, as a pen tester and as a red team, we've leveraged our operational technology experience to combine it with normal pen testing to do things like red team engagements, where if you walk into an organization and you know they have a certain type of device, those devices are common to have certain vulnerabilities like hard-coded pins or keys, where if you walk up and you punch it in, you can obtain the Wi-Fi key for the wireless enterprise network, and then leave the building, go in the parking lot, and connect to the Wi-Fi network and pen test the internal network. I mean, that's a real threat vector. There's also more interesting type of activities around new products that are coming into the space and providing things like at-home treatment or at-home therapy, where they actually take prescriptions over the internet, which is a very interesting evolution of where the future of healthcare is going. But the risks there are exponential, right? So you have prescriptions going over the internet to devices in people's homes. And, you know, we've evaluated systems like that. And in many cases, you know, it is possible, or it has been possible, to modify potentially therapy and or prescriptions that are being sent over the wire and to far off destinations. So just an example of how some of this stuff can materialize. And there's definitely some commonalities across devices when it comes to vulnerabilities that exist in the hardware that may be shared, or potentially software vulnerabilities such as that VxWorks. So why is cybersecurity hard for device manufacturers? You know, this is an interesting question, and when you really look into it deeply, it starts to make a lot of sense. You know, for starters, updates are hard to roll out post-market. I mean, it's very unlikely that a device is ever developed insecure this day and age. In the past, sure, most devices are 10, 20 years old. There's not much security there. It was never designed with that in mind. You can't really blame that device for not being designed in a secure manner. But nowadays, you know, things are built as secure as they can when they ship. The problem is that device can't protect itself for vulnerabilities that may occur sometime between, you know, today and the next 10 years that it's in deployment. They all contain vulnerabilities or libraries that may become vulnerable in the future, and trying to track all of that over that period of time for all the devices that you have is unbearable and not necessarily in the best interest of the business either. You know, it's interesting too from the update perspective, because even if an update is provided that patches a vulnerability, you know, the manufacturer isn't capable of updating those devices over, you know, it's not an iPhone, it can't push OTA, it's up to whoever owns that device to implement it. And in many cases, whoever owns that device isn't paying attention to the updates that are coming out. You have things like essential performance, and what this really refers to is the security balance. You know, you can't take some of these devices and just secure them so much and throw away the key, because it has a purpose to serve. Like, it cannot be, it's not put in place for the purpose of providing cybersecurity. It's providing care, it's doing something, it's operating the elevators. There's only so much you can do there. And at the same time, how do you service it? I mean, there's got to be means for people to get access to these devices at some point in its lifespan. Hardware challenges are real. Secure alternatives, especially for older devices, you know, they weren't always available when it was built, and that's just the way it goes. Cost constraints come into play as well. I mean, in most cases, you know, they're not cybersecurity companies. They produce healthcare products that need to provide their intended purpose. That's the imperative that the device has, and of all things, it must provide that above all else. And then, you know, the costs associated with that. You know, it's interesting to say that device manufacturers should implement so much security, but at the end of the day, a lot of times, you know, that would increase the cost of the device substantially, to the point where maybe it's not obtainable anymore and it's out of the market. And it's interesting enough, you know, we've been part of, seen RFP. I'm not quite sure that I've seen an RFP where a device that was substantially more secure and more expensive was chosen over one that was much cheaper and may not have had all the cybersecurity attributes, because the buyer isn't cybersecurity, it's clinical engineering or whoever else on that side of the house. There's also an interesting conversation and discussion here around shared responsibility when it comes to how much responsibility does the customer bear. Typically, when a device is shipped, it comes with labeling that may indicate how it should be taken care of securely. You know, maybe it should be segmented, or it should be there should be some access control on the network shares that it requires, and that's something a manufacturer will put out, and it's kind of up to the customer to go ahead and implement that. And so there is some responsibility there, because over a period of time, that device is very hard to maintain its security posture, and the customer has to take on some responsibility to find out where it is on their network and segment it off. I mean, at the same time, I mean, is it really the manufacturer's fault, you know, if you didn't know the device was on your network and it can be pinged by a kiosk, you know, in the guest area? It's just, there is some shared responsibility there that needs to be negotiated. Real quick, FDA, you know, it's common to think that this is obviously a regulated industry, and yes, there is cybersecurity as part of that. If that worked in all industries, we would never have data breaches, right? So regulation helps, and there is draft guidance in cybersecurity, but at the end of the day, it can't be so prescriptive because of all the wide varieties and the context in which it has to be used. And that's just the way it's going to be. So as moving forward, if there's more cooperation from the manufacturer and provider side, that is the way out of this. Regulation is typically not going to get us exactly where we want to be. So that's one side of it. On the provider side, I mean, the issues are twofold as well. I mean, you've got all the technical debt of the legacy devices that I spoke about earlier. And you've got kind of two different types of devices here. You've got thousands of old devices in the organization, and then you've got new ones coming in the door. And legacy is everything that's old or retrofitted. New devices are the ones that cybersecurity was actually a part of and engaged during the purchasing process. But one of the biggest struggles that they have is just accessibility. You know, new devices is slightly better, but at the end of the day, it's an embedded system. It's not necessarily serviceable. In many cases, if the device is old, it's not worth an upgrade, or there is no upgrade because there's a new version of the device available. And in many instances, you know, a manufacturer may recommend that they buy the new one instead of trying to upgrade because they don't support that one anymore. Traditional cybersecurity capabilities may not even apply. And this is really the tough part. So we have embedded devices that we don't manage, we don't have access to, and we can't really network segment them completely without really understanding the needs of that device. on making sure that that is done properly. It's really hard to do that and not potentially endanger the device. So if you segment it in a way that it potentially doesn't work in a time of need, that's unacceptable. SOC monitoring is hard too. These things don't spit out events to your SOC to monitor. And certainly on the IR and forensics side, I mean, good luck trying to open up the device if you think an event happened without destroying it. So there's many struggles on both sides of it, and ultimately this comes down to a balanced approach. And you have to have a disciplined approach for looking back at the legacy devices and trying to address that at scale. But you cannot spend all your time kind of looking in the rearview mirror because that is the past. I mean, that stuff is there, and you need to address it in some manner by prioritizing the risk of the devices. But at the same time, you have to provide services as a cybersecurity organization to enable the secure adoption of newer, smarter devices. Those newer devices are arguably riskier because they have more functionality that can control almost all aspects of the device. You know, an older legacy device may be on the network, but you can't control everything because it's not that feature rich. But new devices, that is definitely the case. So in this situation, you know, you have a device issue and it needs security, but too much security can be bad. And in cybersecurity, we're really in the business of risk management. You know, security is often seen as binary, either it has it or it doesn't. But this is the perfect example where you have to balance those two to be successful. So that's it for me. I hope that was beneficial to everybody to learn about some of the risks. And now I'm going to hand it off to Kevin to talk about the solutions.
Hi, everyone. My name is Kevin Tomasio, and I manage the medical device and operational technology cybersecurity program here at Cleveland Clinic. If you haven't heard of us, we have over 200 locations, 5,800 hospital beds, 66,000 caregivers, and roughly 8 million visits last year. And before I continue, I first want to acknowledge the current pandemic situation and the struggles that many of us are facing in healthcare. Big special thanks to all the healthcare industry participants today who are helping and work on a daily basis to keep their patients and clinicians safe from this and other cybersecurity risks. Thank you for all the hard work that you're doing at this time in healthcare. Unfortunately, we continue to see threat actors take advantage of this situation, and so it's important that we have these conversations, we remain vigilant and ready for what happens. Let's see, try to advance. Our patients come to us at the most vulnerable moments of their lives. The last thing on their minds at that point should be whether the devices that are delivering care to them are safe. My team takes this responsibility very seriously, and we work every day in order to ensure that these risks are managed to protect our patients, our caregivers, and our organization. So you may be in a similar situation as I was about 1.5 years ago when I arrived at Cleveland Clinic. I came from a different industry. I came from the industrial control system industry, which has a lot of cybersecurity skills and experiences there. And I also had different perspectives as a vendor. I'd never been an end customer. I'd never been fully responsible for cybersecurity. And so it was very daunting for us to sit down and figure out, how do we get started here? And as I began to hire up my team, we had a lot of really great conversations, a lot of really good questions that we sat down together and looked at and tried to figure out as a team. So things, just basic questions, you know, where do we begin? What is our scope? What are the biggest threats we face in our environment? What cybersecurity standards and frameworks can help us build a program that's going to meet the needs of our patients and caregivers? What types of cybersecurity controls are already in place? What do we already have? What are the tools in our toolbox already that we can take advantage of? What are IT systems and controls that we have that are already in place that we can, you know, take advantage of? We can use that to also protect the operational technology side. And then, do we have a complete and accurate asset inventory? You know, do we know the full scope of what we need to look for within our environment. So the goal of this presentation is I want to kind of share some of what we do, share some of the experiences, because likely I've had a lot of great conversations with peers at other hospitals over the past year and a half. And a lot of times the questions are just, where do we begin? What can we use? Well, how do we get going here? So I want to kind of share some insight. It's not to say that this is the perfect model for anyone. This is our model, and I'm hoping that there's something here to take away that can perhaps help your organization. So as we started pondering a lot of these questions, we kind of started thinking a couple different principles started to emerge. The first is that we really need to think about a continuous effort. So as many of us know, cybersecurity is not a one-time ask that you do. It's not a one-time set of efforts you do. It requires continual care and feeding in order to establish and maintain a level of trust, a desired level of cybersecurity within your assets. So our our procurement teams and institutes already had a very robust lifecycle model when it came to purchasing, integrating, operating, and decommissioning equipment. And so our approach was to really kind of take that existing model and look at how do we add cybersecurity elements to that model in order to get the outcomes that we're looking for from a cybersecurity perspective. And I'll talk about what that model looks like over the next couple of slides. The second was we needed to have very strong internal partnerships. And so how are we organized is a very common question that I get asked by other institutions. How are we organized? You know, we roll up through the CISO organization, and therefore in order for us to be successful, we have a network of operational groups that are the hands and feet on the ground that are actually touching the medical devices, they're repairing medical devices, adding protective controls to them. And so how do we build a relationship with them so that we have some, we can work together to make a difference here? And then third, another question we had was, how can we leverage our experiences and help improve the industry? How can we partner with like-minded institutions and help drive thought leadership so we can give back to the industry? And so I'm going to talk a little bit about some of the efforts we're doing there, and there's lots of opportunities in healthcare for us to collaborate and work together for some common solutions. So our life cycle model, so again, we looked at, we have an existing model, let's add cybersecurity to that existing model, as opposed to trying to create a new set of processes or a new set of frameworks. So we look at it across 4 different phases. There's an established phase where new devices, we have a questionnaire process we go through with vendors. It's important that we kind of look at a couple different perspectives. We want to look at both the quality of the vendor themselves. Do they have a secure development life cycle? Do they have secure code practices for their developers? Do they take security design into consideration? Do they pen test their devices before they release them to market? And so we have a conversation around the vendor as well as the actual quality of that device. So was that specific device pen tested? Was it built with security in mind? What does the software bill of materials look like for that product so that we can be prepared to manage the security of those devices? We also will work with the vendor on a legal language questionnaire at that point. So we have specific cybersecurity contract language addendums that we bring in that talk about KPIs for vulnerabilities, for working together if there should be an incident, for other things that are important for us to be able to take responsibility of securing that device. Once we've made a purchasing decision, we have an integration phase where we can take more detailed look at the device and the system that it plugs into. Many of these devices are not just connect to the network and you're done. Many of these devices have server components, they have cloud components, they have on-prem servers that have to be added to our infrastructure. There's oftentimes remote access that has to be considered as well. And so we go through a process to really kind of do a deep evaluation on the chosen product and come up with a security-focused design that brings that device into the organization. The operate phase is where the device spends 99% of its lifetime. So this is, again, where you've invested in the beginning of the security life cycle. Now you have to continue that investment through its operational life cycle. So continuously monitor the environment for threats using our passive network monitoring tools to bring events into our security operations center and empower the analysts there to take action if an alarm event should take place. Things like vulnerability management, understanding what are the known vulnerabilities these devices are exposed to, and what's our plan for remediating that vulnerability. And then lastly, decommissioning. So it's important to understand that these devices oftentimes can have a tremendous amount of sensitive information, everything from business sensitive information like privileged wireless credentials, privileged Active Directory credentials, also patient health information, or PHI, and personal identifiable information, or PII. So these can represent a risk to both our patients and to our organization if this information falls into the wrong hands. And so we're building in practices here to, when we do remove devices, perhaps we have to go and shred the hard drive, perhaps we have to physically destroy the contents, perhaps we have to go through a wiping process to make sure that device is truly clean from a data perspective. So again, kind of going back to what I was saying in the beginning, what assets do we have? So it was important for us to understand the scope of assets that we have here. And so we were fortunate that our clinical teams had a manually compiled asset inventory. But as we all know, the real asset inventory isn't just what's in the database, it's also what's on the network. And so we came up with this concept of the trusted asset inventory, which first brings in, passive network monitoring in order to bring that real-time, true picture of the assets that are in our environment, so that we can understand kind of the superset of that information that we see when we compare the offline assets to the online assets. We also then kind of marry in our network topology information. Our vulnerability scanners provide information about known vulnerabilities into that asset inventory, so we can start to build a picture of where these devices are and what risks they start to present. We've then also added in threat intelligence information and our risk assessment process in here in order to bring a more clear picture of where the threats are in our environment. As a result, we can then start to prioritize our assets. We can start to focus our resources on what is truly the most important in our environment to go after and begin to make meaningful progress on this problem space. So the output of some of this is, from our asset inventory, is we're going to be able to drive work orders. We're going to be able to drive technicians on the ground to go off and apply protective controls or apply device hardening to these devices so that we can start to reduce risk. We can also ensure the Security Operations Center has information about where these assets are and who's responsible for them, so that they can take actions and follow their processes when an incident should be detected within our Security Operations Center. So really, as many of us know, the asset inventory is the heart of the system here. And so again, very important to go back to the beginning, look at, what is the scope, where are the devices, what are they, what level of risk they represent, because you're always going to be looking for the most important assets to pull into your control and start to apply your processes there. So a little more detail of how we integrate new assets. So as I mentioned, the first step is really to kind of look at the new risks, analyze the risks that a new asset would bring into your organization. There are some industry standards for developing questionnaires that you can use with conversations with vendors. However, we've kind of simplified things. We went down to more of like a 20 to 25 question questionnaire to have conversations with our vendors, because we weren't seeing as much value from asking 100+ questions out with our vendors. It just wasn't worth the time. We weren't seeing incremental value from that. So for now, we've kind of shrunk it down into 20 or so more meaningful questions that can drive these processes. Performing detailed analysis, pen testing, security testing of these assets to understand what the risks are. And then we're using FAIR. We're using a risk scoring system to analyze what is the risk of this asset as it presents to our environment. The next step is identifying controls. So we take a defense in depth approach. We look at everything from the network level to the endpoint level of security controls that we have, and design a plan for that device. What are the controls we can put in place that reduce risk with the greatest return on investment? And from there, we can then compute a mitigated risk score. So this is the second risk score that is lower based on the level of controls we can put in there. The third step then is to deploy the controls. So issuing work orders for assets. We support our teams on the ground who are building procedures, supporting the technicians going out and installing, endpoint protection, for example, on Windows-based medical devices, and support that effort, help them qualify and support that as it gets pushed into the organization. And as I mentioned, legal language to protect us, to ensure we have a shared responsibility model between us and our vendors. And then the last phase, once we get new assets, is again, prioritizing for future actions, monitoring for alarms and events. We want to enable our security operations center to take action should an incident take place involving one of these devices. So the way that we are approaching this, from the IT perspective, one of the things I've seen my peers do is come up with protection profiles that are based on an operating system or based on a specific, very specific use case, say like Windows 10, for example. The challenge with IoT is that we have an incredible amount of diversity in these devices. We don't have the common operating systems, common hardware, common risks across all these different OT assets. And therefore, we had to kind of think of what's a different approach we could take in order to start to measure the risk as well as to automatically assign protections to these. So we came up with a system that we call the taxonomy, and basically it's a group of common attributes that are found in medical devices and OT devices. And we take the questions that we ask the vendor and we basically map it to those different attributes. So for example here, identifying risks in these common attributes, let's talk about 4 different attributes we see in medical devices. A lot of them have USB ports for data transfer. They have authentication and authorization capabilities. They'll store, either transmit or store PHI, and they might have a web server to share information or to enable configuration. So we go through and we do a risk assessment. We talk to the vendor, we look at data sheets, look at product manuals, and we figure out how well does this device adhere to these, secure these attributes, for example. So how well does it implement a web server? Did they use TLS 1.2 as opposed to SSL 3.0, for example, or did they use TLS at all? So we'll basically kind of at the end be able to map those answers into these attributes and then score these attributes and understand that in this case, okay, we're really concerned about the USB ports, kind of a medium level of concern around the web server and PHI, but they did a really great job with authentication. Okay, so now we've got our risk profile here. And so we can move on to the second step, which is how do we map controls to protect these attributes? We want to bring everything up to an acceptable level, to a green level here, that represents our level of risk appetite for this specific device. So in order to do that, we're going to have to issue some changes to these devices. So basically, we need to empower our operational technology teams out there to do certain things to both the endpoints and the network in order to meet the level of risk that we're looking for. So we'll create a protection profile that's not specific to that device, but really is a collection of protections we want to apply to devices that have these common attributes. So then we take that protection profile and then we can issue work orders. We can issue work orders to our clinical teams, to IT partners out there in order to get them engaged to bring out the level of work that needs to get done to secure these devices. So instead of thinking about a common or a security baseline for every single medical device, the goal here is really we have a collection of small protection profiles specific to a attribute of that device, and we can kind of piece common protections together into a plan for each device. So with this, we're able to, for new assets, we're able to more fully analyze new devices as they enter our organization. New devices today have much more connectivity and capabilities and therefore require a much deeper level of scrutiny. However, we've got a large variety of existing medical devices in our space. And so what we've arrived at is needing to start to take a little different approach with our existing devices. And in this case, what we've discussed is taking more of a threat-centric approach to really understand what are the biggest threats in our organization to these existing medical devices, and start to craft a plan for the wide classes of these existing devices. So, for example, let's take ransomware. A lot of people would argue that ransomware is the #1 threat in healthcare. So let's take a ransomware threat actor and kind of look at what are the controls we have in place, either effectively implemented or partially implemented, that could potentially stop a threat actor who's trying to bring ransomware into our organization. So what are the things we can assign here? What are the things we can identify here that might apply to dozens of different product families in order for us to gain a level of protection against our #1 threat? So we can also look at what are the controls in place to detect and respond and recover should a ransomware event take place. Do we have logging? Do we have incident response in place so that we can kind of quickly recover? So we'll take a look at both the preventative and detective controls here as it relates to our biggest threat. And then we can use this information to initiate projects with our OT partners in order to execute and then, of course, support them along the way. So taking an asset-centric approach, it does allow you to take a much deeper look at each device, and you can outline all the different risks that that specific device entails. But this threat-centric approach kind of looks at it from a different perspective. It really isn't going to allow us to identify all the risks and all the devices, but it will allow us to be able to speak to, hey, our biggest threat with ransomware, we're able to make meaningful risk reduction on thousands of devices by studying one control and applying it to our environment. So it's going to allow us to, we think it's going to allow us to more quickly protect a broader set of assets against the most important threat we face. I mentioned partnerships. So it's incredibly important we build partnerships around our organization to support the OT organizations that we support. Our partners are the technicians on the ground who deploy endpoint protection. They're the IT engineers who control and manage our network level protections or deploy and manage our databases and our servers. Legal and supply chain resources that help operationalize the program and help protect us from a legal perspective by deploying our legal language and guarantees within our contracts. So it's incredibly important we have these partners. A quick example here, so if we're purchasing something new, we might first look to clinical engineering or health technology management teams to give us support as we take a look at the device. But then we quickly have to talk to our IT networking and telecom groups, because there might be network changes, there might be firewall changes that we need to make in order to bring the device in at that level of security. We'll engage our legal and our supply chain people to help with the contract language, help with the guarantees that we want to have written into our contract language to protect us. We'll also have to engage other cybersecurity teams, endpoint protection, identity and access management, which falls under our CISO organization. And then lastly, our IT infrastructure team. So again, spinning up servers, data storage, how do we protect the information? How do we prepare for disaster recovery? All of these have to be in line in order for us to bring a device into our organization at the correct level of risk. So it's not just about our team. We're really helping to orchestrate this larger process with these extended OT partners in order for us to be successful. So I would really encourage everyone in my position, if you're a peer at a different healthcare institution, to really also be thinking as much about people as we think about processes and technology. We often think about technology and processes, but it's very important to have the relationships, the personal network you have to have, the communications before, during, and after these projects in order to get the other partners buy-in and support. Training and awareness is obviously very critical as well, to build awareness into the clinical users, the end users, the technicians, who may not understand the threats. They may not understand why it's so important to look at the threats in a medical device and understand what the possibilities are there. So a note about helping our community. We're involved in a couple different initiatives here, but I want to highlight one here. We've partnered with the Health Sector Coordinating Council, which is run out of the U.S. Department of Health and Human Services under Greg Garcia. And we've created a task force to build some modular cybersecurity contract language which has three goals really: to drive alignment between MDMs and hospitals, so we have the same targets, the same expectations. Simplifying procurement of contract language. It's very costly and expensive for both sides to go through this contract language exercise and negotiate here. And also have clear expectations and KPIs, what we're looking for from a cybersecurity perspective. The more alignment we can have in this industry, the better it is for both hospitals and for vendors as well. So if you go on Google, you can find this group. We're still kind of in the early stages of this contract language project, and we'd welcome more participation both on the MDMs, the medical device vendor side, as well as the care provider side. And lastly, I want to kind of talk for a couple minutes on lessons learned. The first is lesson learned over the last year and a half is to really, if you're in a similar position to me, look at focusing on IoT, not just medical devices. Quick story, about 2 weeks into my job, I was hired for a medical device program, but someone gave me a report of the cybersecurity of our electrical system. We have a lot of power generation on our main campus hospital, and was basically like, hey, nobody else knows what to do with this. Nobody else knows what a PLC is. Can you look at this? And that was really the light bulb going off that, you know, we really needed to focus on building an operational technology program as opposed to strictly medical device program. 80% or so of the medical program is really just operational technology. So I'd really encourage you to start thinking about the whole problem space, not just medical. You know, the highest risks you face might not necessarily be the medical devices. If your electrical system, your power generation system isn't protected, if your HVAC system isn't maintaining the right air temperature, air quality in your facilities, those could potentially have much bigger impacts to your business operations. So it's important to look at all of the scope of IoT and OT from your risk perspective to understand what's truly most important. Also from a program cost perspective, many of the processes and tools that you'll need to develop are going to span multiple OT domains. And so if you just focus on building a medical program, you're losing out on that potential return on investment for building a more comprehensive program that looks at all the different areas of OT. The second lesson learned is really around balancing practical with theoretical. So a story there. So imagine a situation where we look at a device and we see that we're using, say, a default pin on something. So in cybersecurity, our minds are like, wow, we need to change the default pin, right? That's an obvious fix that we could make and we could reduce risk there, right? Sounds good, right? Well, the reality is we had to learn about the cultural impact of some of these cybersecurity changes. So for instance, you know, okay, you want to change the pin. Well, can you retrain the staff? Can you retrain the nurses and the clinicians that have used that pin for, you know, a decade or so? Can you reprint all the manuals and retrain everybody? So it brought up a lot of very challenging questions to us around how to approach security. You know, endpoint protection is very expensive and time consuming, and it has that culture change that you may not be expecting or prepared for. You know, if you change a server, if you patch a server, you change the configuration, nobody's going to notice that. But if you want to change the user experience or the workflows in the medical devices themselves, that may be a challenge. It may be an expense that you're not prepared for. And it's going to be a challenge to get a change like that approved and pushed out to the organization. So you have to focus on the things that not only bring cybersecurity value, but also kind of minimize the culture change as you bring those new controls in place. And the last lesson learned, I'd say, again, progress over perfection. I think a lot of us try to aim for perfection, but I really want to stress it's more important to aim for progress. A couple, you know, a short example might be figuring out the right way you want to measure risk. You know, there's a lot of different models out there. There's proprietary models, industry standard models for measuring risk. Really, in the end, you have to figure out what works best for you at that moment and start to make some meaningful progress there. You could kind of do analysis by paralysis and go too deep and, you know, kind of keep perfecting your model. But really, if you take a more agile approach, you know, you can display some more results, achieve some more results quicker without getting into some of that paralysis. Expect to make mistakes. There's no perfect manual for this type of program. But focus on the basics, focus on your hygiene, focus on building your asset inventory, figure out your vulnerabilities, get visibility into the system so you know what's there, because without that foundation, you're not going to be able to have a successful program.
Hey, Kevin, this is Russell Rice coming back. Hey, thank you very much for walking through that with a group. Folks, I know we're at the top of the hour. We've got a few more minutes. We were hoping to do some Q&A, but one thing I wanted to make sure that you're aware of, we will respond to all the questions that people ask separately in email, so you'll all kind of see all the questions and all our responses to it, but I wanted to cherry pick a few before we wrap up. And I think, Kevin, most of these are going to hit you directly. Several people were asking just kind of the scope of your team, kind of how many people you got, what's the scope of the equipment you cover? Is it medical and OT only, or do you handle other devices? Are you responsible for firewalls or AV? And give us a scaling question and answer, if you don't mind.
Sure. So my team itself on medical devices and operational technology is 5 cybersecurity engineers who are working directly. And again, it's that picture of working with our OT partners across the organization to be successful. So the larger cybersecurity organization in Cleveland Clinic is around 100 individuals. We have groups that are responsible for everything in the NIST cybersecurity framework, from protection, detection, response, and recover. We have different teams who are responsible for endpoint protection, architecture, and so on. And so my team works as a partner with them in order to drive the controls and mitigations for medical devices and OT.
Okay, cool. Another question came in, which was about building a good set of inventory. Basically, Rich was curious, when you're trying to build a trusted inventory of systems that are under your protection, how do you go about that? What did you do? What tooling did you use? And who was involved in that effort?
Sure. I can't get into specifics around the specific tools that we use. But again, it was important to understand, what was there already. And we were fortunate that we were already in the midst of an asset inventory modernization effort that, wasn't driven by my team, but we were able to kind of influence and help drive from a cybersecurity aspect once it became there. I think the most important thing to do is assess what assets inventory you already have, and then understand what's the level of confidence in that asset inventory. It's probably going to be a case where you're going to need to bring in a passive network monitor element to it in order to get the visibility. I suspect that, much of our asset inventory, we discover things that are outside of what was manually there, so it's a surprise. We're also going to see things that, probably are not connected or not on the network, and so they're going to be things that are manually put in the asset inventory, and they may never cross our sensors to detect them from a passive network monitoring perspective. So I think it's important to really understand the superset of that. I think it's also important too, we have other tools in our infrastructure that are doing vulnerability scanning, doing patch management from an IT perspective. And I think you can start to also kind of compare those different data sets to understand what is your true picture. In an organization as large as ours, I saw the question around, 300,000 devices is probably about right. You're never going to have a perfect asset inventory. And so you can pull it together as best you can, apply your prioritization methods to it, and begin to empower meaningful risk reduction with that information.
There was another question, I'll probably pick 2 more here. How much influence does the cybersecurity group have when you're dealing with the purchasing decisions for medical equipment? Kind of how does that interaction go?
Sure. In our organization, really the business owner, the institute is the risk owner, if you will. So our role here is to empower them to make a good decision. When it's in the case of multiple products, we'll weigh in where this product A is better than product B from a cybersecurity perspective, and give that recommendation to them. We view ourselves as a team that's empowering the choice, because we have to remember, in a lot of cases in medical devices, you may be dealing with, there's one vendor that makes a specific device. And so it really isn't a question of saying no. It's more of a question of saying how. How do we bring this device in at a level of risk that is acceptable to us? There's always some level of risk reduction you can do, whether it's segmentation, put firewall directly on the device. There's always going to be something we can do to minimize the risk here. So our role is really about bringing it in at a level of risk that we're comfortable with. We hope that our business owners pick the best device, but if it's the best, cancer fighting device in the world or the best heart surgery device in the world, we're going to figure out a way to bring it in and manage the risk appropriately.
It's about the care delivery at the end of the day. Hey, we'll flip away. As I promised, we'll answer all of the questions that came in and in an email thing. And let me hand, and Kevin, thank you very much. Jason, thank you very much. Let me hand the baton back over to Jessica.
Sure. I just want to add one quick thing too. All of us are on LinkedIn, and we're happy to connect with you, answer additional questions. If we don't have time, feel free to reach out to us, and happy to continue the conversation.
Thank you very much, and thank you to our speakers, Russell, Kevin, and Jason, for your great presentation, and to Order for sponsoring this webcast, which helps bring this content to the SANS community. To our audience, we greatly appreciate you listening in. For a schedule of all upcoming and archived SANS webcasts, including this one, please visit sans.org/webcast. Till next time, take care, and we hope to have you back again for the next SANS webcast.